Usec, speaking of healthcare capacity, there's also some confusion. Dr. Maricar Limpin of the physicians group says that the critical and severe cases in Metro Manila have gone up, and ICU occupancy is almost 100%, at least in her hospital. And she's seeing a similar pattern in just the past week in Metro Manila. But the DOH says this is not the case. So what's really the real picture in Metro Manila?
Yes, ma'am. Actually, we tried to review when we heard of this news. And we tried to look at our figures and looking at our utilization rates across the different hospitals in Metro Manila. And what we found out would be that there would be about 19 hospitals that really, when you look at the parameter, they are almost full for their ICUs. But when you look at the number of beds that they have in their hospitals, it's quite small. Some would just have 2 ICU beds, some would just have 3, the others would just have 6. So these are the smaller hospitals that we have in Metro Manila. And one of the things that seemed strange because the numbers were not equating to this full ICU. So we will be conducting further investigation. But for now, what we can say would be we understand what Dr. Limpin is saying because we know that they are the doctors and they are the ones on the ground. But having to look at the whole expanse of our hospitals in Metro Manila, we can say that we are at that safe level still. Although some of these hospitals may be full because it would be that their ICU beds are just at that minimum number.
I checked po your figures yesterday. In Metro Manila, the ICU occupancy rate was only at 48, I think. And nationwide, the ICU occupancy rate was at 52. So that's why we had a bit of confusion there kasi when we were listening to Dr. Limpin, I think earlier this week, alarmingly almost 100% raw. So it's not even close. Yung numbers are not even close.
Laki ng
Well,
discrepancy.
we have to understand also how they feel. They are the ones, in front and taking care of the patients since we started, and they're really tired. So just a little, signal of increase in the number of cases and increase in the number of beds being occupied, that really sends a signal to them, and they really want that we do something at once, and we are responding.
Hindi kaya there's a difference between ICU beds for COVID cases and ICU beds for the general cases? Maybe
There really is, yes, ma'am.
Ah.
Yes, ma'am. There really is a difference between these two. That's why we say we have COVID and non-COVID beds. And what we include in our reports would just be the COVID beds.